Mr. Chairman, thank you, and thanks to all of the witnesses for their testimony. And Mr. Pallone, Mr. Suozzi, I want to thank you both for your leadership on this legislation, the Protecting American Lungs and Reversing the Youth Tobacco Epidemic Act of 2020, which I strongly favor. I first learned about the vaping thing from a friend of mine who actually lives in New York City, named Meredith Berkman, who called me a couple of years ago and said that her son's school was engulfed in this epidemic where the vast majority of the kids were using this and couldn't stop. They were basically addicted. They were smoking in the bathrooms. They were smoking on the weekends. They were using the vaping product whenever they could. It's expensive. It's harmful. The kids are winded. They're athletes who can't perform because they're using it. I assumed it was some kind of big city problem, but I started asking around in my district, and what do you know, in Montgomery County, Maryland, which is overwhelmingly suburban, and Carroll County, which is overwhelmingly rural, and Frederick County, which is a mixture of the suburbs and more country areas, everybody's dealing with the same problem. It's an absolute epidemic affecting our kids. So we are in a national public health emergency crisis over this vaping epidemic. And I've heard stories of people who actually are working for the vaping companies going into public schools on anti-smoking campaigns where they say, whatever you do, don't smoke, but if you want to try it, you've got to try vaping. Do vaping instead. That's better. And then they target young people by marketing the product near school areas and where they know young people are going to be. Last year, a quarter of middle school students in America and half of high school students in America said that they had tried it. And 5 million, more than 5 million were users, and 1 million were using it on a daily basis. So that's a profound problem. At this rate, we are going to have millions of kids who suffer serious health effects and die prematurely from a smoking-related illness because of the vaping epidemic. I think this legislation is the very least we can do. It will ban the manufacture and sale of all flavored tobacco products and stop companies from targeting kids and teenagers with their advertisements. So it will get the flavored e-cigarette products off the market within 30 days, and thus we hope we can at least prevent future generations of kids from taking up smoking. We still have to deal with the public health epidemic of those who've already started it and are going to have a very hard time getting off of it. So I just want to salute the members of the committee for taking strong action quickly on this, and not phony action, not something that's easy and insufficient, but something that really will make a difference in terms of advancing and protecting the public health. I'm glad that this legislation will invest in educational and public awareness campaigns to target and reduce youth tobacco consumption and to strengthen public health programs that exist now on tobacco cessation and on educating people not to get into it in the first place. So with that, I yield back, Mr. Chairman.
Thank you, Mr.